Welcome to the world united. Welcome to the world united.
Dr. ROMY PAREDES, he is the visionary founder of Wellness Land Health Institute and Wellness Land Wellness Center, a leader in the field of natural and complementary healthcare and education. His Holistic Retreat Center is a member of the Holistic Centers Network. Website is www.thecenternetwork.org, an international network of holistic centers whose vision lies at the heart of each one, a commitment to transforming the lives of the many thousands who attend their programs as well as those who run them by addressing the new consciousness emerging worldwide. He is a graduate of Bachelor of Science in Chemistry at UP Diliman, Quezon City. He finished his medical degree at UP-PGH Medical Center. Over to you, Dr. Romy Pardes. Thank you so much.
Yes, yes. Can I share some slide?
Yeah, sir. Yes, please. Over to you, sir.
Yes, yes. I'm trying to share now. Okay. There you go. Can you see my slide? Okay, so I've been practicing. My slide can be seen already, right?
Yes, doctor.
Okay, okay. So I've been a practicing holistic medical doctor for the past 20 years. And my realization is, yes, there is a bridge between holistic medicine and conventional medicine. My background is I was trained in conventional medicine, but mostly it is treating the symptom, not treating the root cause. So for example, there is a tumor, we remove the tumor, we burn the tumor using radiation or chemotherapy. But to me now, after seeing a lot of cancer patients, which again, I apologize, I was late today because I had to attend to a cancer patient urgently. There is so much pain, there is so much suffering, and after dealing with a lot of cancer patients for so many years, to me now, a cancer, a tumor is not just there without a reason. To me, in a higher vibration, it is an invitation for humanity to transform, not just on a physical, mental, and emotional, but on a spiritual level. A tumor to me now is a divine shout. It is a highly vibrating energy field that is shouting to humanity. So, because the tumor did not come from another planet, the tumor is not there to kill a patient. The tumor is actually there to transform a patient and to transform the people who are looking at the tumor. So that is why I call it transformation as a powerful medicine. The problem with the medical system, which I was also trained, is we are always looking at the problem and trying to solve the problem. I believe that the only way to solve the problem is we change the way we look at the problem. We go deeper. So a new era of human health begins from treating the root cause. The complicated is turned simple, patient-controlled, self-empowering, built by the people. So this is already in part an answer to one of the questions earlier. How do we transition? Yes, there is a way to transition by influencing the medical community, not just attacking the medical community. It is called, how do you call that? An inclusive consciousness, because there is so much suffering already in the medical system, so much frustration, because we are not trained to look at the disease in a different perspective. So there is so much fear, and fear is a powerful vibration that closes the immune system. So in our holistic center, we play with words rather than us doctors looking at laboratory results coming from laboratory machines made in China. We label a room instead of a laboratory. We call it a laboratory because in that story, there we could find what really went wrong as far as the vibration or the root cause of the disease is concerned. So from purely drug pusher, yes, I was trained to prescribe every single drug that was available in the market. I was trained to treat every single symptom. But now, these are the things that we prescribe to a patient. Walk barefoot, hug trees, relax more, let go, love more, allow, surrender, and the power. There is a miracle of surrender because of my dealings with a lot of patients, especially cancer patients. There is so much fear, and fear is a powerful vibration that closes the healing systems. And not unless we confront that fear and the patient will confront that fear, then they will live in fear and all their actions will be in fear. From stethoscope, which, you know, most of us doctors, we even wear a stethoscope while walking in the supermarket, but I don't do that anymore, to holoscope. Holoscope meaning we look at the, you know, at the full dimension of a human being. So the principles of the lab-based healthcare system is it should be understandable. And I always explain to people, whatever is the disease, whatever is the diagnosis, health is understandable for everyone. And whatever is the disease, there are only two bottom line causes, which is toxicity and deficiency. If there is a toxicity, toxicity means something is there in your body that is not supposed to be there. Deficiency means something is not there in your body that is supposed to be there. So whatever is the medical term, whatever is the label, because like, for example, cancer, the cancer that I handled a while ago is he has an invasive ductal carcinoma of the breast with metastasis to the lungs. But people don't understand, you know, all those medical terms. So it should be safe, it is a human right, and it should be affordable for everyone. So every living room will become a space for self-help empowerment. It's not just the hospital, it could be in, you know, while you're talking to somebody, in your living room, etc. So the priority of the lab-based healthcare system is the natural prevention and eradication of diseases and the transformation. So this is what I've been saying, transformation of fear, which is a powerful vibration to close the immune system, into love, which is a powerful vibration that opens the immune system. So it should be patient-oriented rather than medical-oriented, because we think the medical community is there to solve problems. I don't think so. The moment we do not treat the symptom is the moment we just treat the symptom and not the root cause is the moment that we are trying to make the problem bigger. For example, when we prescribe a hypertensive medication to a hypertensive patient, the blood pressure will lower down today, but tomorrow the patient will still be hypertensive. So we were trained to tell them to continue taking the medicine for the rest of their lives. So in effect, we are telling patients to maintain their disease, to maintain their medicines, their drugs, so that their disease is also maintained. So we have a movement in the Philippines called the Self-Help Empowerment Movements, and we are bringing supportive, conscious, and healing approaches to people that need them. So we are reaching out. Before the pandemic, we travel a lot around the Philippines. We go to communities. We educate and empower through health empowering seminars, programs, and retreats. So we are building a national movement of community of like-minded people interested in the conscious evolution of the healthcare system. In the beginning, we were faced with a lot of resistance from the medical community, but now more and more medical doctors are beginning to open their minds. So instead of hospitals, of course, we need hospitals for acute cases, but hospitals can be the future hospital, meaning people can be empowered and they could use their kitchen as their pharmacy. And of course, we still need the hospital system. We still need the conventional medicine, especially for acute cases. For example, a few months ago, a gunshot wound was brought to our center. You know, maybe they did not understand what we do. They thought we are a medical center, but we are a holistic center. So I told them, this is not the place for a gunshot wound. You go to the hospital. So we need that. But in my experience, there are hundreds of diseases that are chronic, not acute. So therefore, majority should be channeled towards holistic centers who deal with chronic cases rather than acute cases. Only a minority of diseases is actually acute. However, it is monopolized by the conventional healthcare system. So no matter how many hospitals we build, how much medical sciences develop, health is not going to happen unless each individual takes it in his or her own hands. Each one is responsible for their own well-being, for their own joy, and for their own ultimate liberation. That's why our approach is empowerment and educational, rather than just asking a patient, what is your disease? And this is the medication. So according to Sadhguru, the founder of Isha Foundation, which I attended one of their programs in Hong Kong 3 years ago, he said, unless societies create the opportunity and possibility for every human being who seeks to come in touch with the source of creation, there is no true well-being. So governments, corporations, and administrations can provide the infrastructure for well-being, but the source of well-being is within. So the transformation not have to happen first within us, within the patient, within the human being, before the transformation can happen on a larger scale. And only in taking charge of our inner nature will there true liberation for humans. And in our own little ways here, in a very small country called the Philippines, which is composed of 7,100 islands, in our own little ways, for the past 15 years, we have been trying to reach out beyond our comfort zone to more and more people, whoever is interested in transforming their house into become a hospital and in making themselves become their own best doctor. So yes, in parting words, in my realization as a medical doctor who was trained in conventional medicine, but after I finished medical school 20 years ago, I decided to walk the less traveled road of medicine, because one of my turning point 20 years ago, before I finished medical school, I was in the hospital. I saw a 5-year-old boy kneeling on the floor, vomiting in the toilet, undergoing a chemotherapy, losing hair. And when I saw that incident, which I could not forget, what I realized that day, 20 years ago, what we were trained to do, we were not trained to empower a human being. We were just trained to bombard a human being with pharmaceutical medicine. And that day, 20 years ago, that incident opened my heart, and that day made me surrender the arrogance of my mind as a physician, as a medical doctor, and that made me open my heart and explore the higher dimensions of truth. So my realization, my dear friends, is the fastest healing is a healing of perception, because when we heal our perceptions, we no longer try to solve problems never ending. The problems begin to dissolve. And the most powerful medicine is transformation, because every disease is just an invitation to transform on different levels of our humanity. So thank you very much.
Thank you, Dr. Romy Paredes, for wonderful presentation. Being a medical doctor from the representation from modern medicine, being a representative from modern medicine, encouraging, inspiring the people, and to be on the footsteps of the complementary medicine and to be on the footsteps of holistic and integrated approach, that is extremely appreciable. Thank you very much. Please stay tuned. So we are just discussing before you entered about the possibility of integrated approach, because let me share for a minute about what this. Yeah, please, for a small certificate, a small token of appreciation. So the discussion was going about, yeah.